are delicious, falling off the bone. All right, do you want that before the baby body back? Not feeling in love with those love handles? Well, there's a new procedure where doctors can reshape those trouble spots and you hardly miss a beat in your holiday shopping schedule. Here with details about the new Lipocontour procedure, please welcome Dr. Chris Livingston and his patient, Jackie Klein. Okay, I only tasted these. I didn't eat the whole, I was just tasting it.
That would be easy to work off.
Yes. Yes.
With my technique.
You're like, please eat more of these, right?
Right.
All right. Whenever we say the word lipo, a lot of us flash back to the beginning days of lipo. This is different. Explain this procedure.
It's really a revolutionary technique. It's ultrasonic liposuction, and it works through a very, very small probe that's the size of about 2 millimeters. And the probe, through ultrasonic energy, heats at the very tip. And that tip lyses or breaks fat cells, just like a stick of butter in a hot pan.
Wow.
And that probe then takes the fat cells, and when we remove it with traditional liposuction, it doesn't injure the nerves, blood vessels, soft tissue.
A lot less trauma to the body.
Much less soft tissue trauma, and the downtime's less.
Yeah.
So it's not painful, and you have a faster recovery. All
right, and Jackie, you had this done.
I did.
And what was the issue that you were dealing with?
I just had, you know, those little love handles that you can exercise all you want and diet, and you never get rid of them.
Yeah, all right, I want you to unbutton your jacket. I want you to stand up. She's afraid because I told her people look bigger on TV, and she's like, uh-oh, right? No, but look how flat that is. And how many children do you have?
I have 3.
She has 3 children. Okay, this particular procedure is great for spot reducing. This is not someone who comes in and says, hey, I want to lose a whole bunch of weight.
Correct.
It's really contouring the body?
Yeah, it's for first of all, any type of plastic surgery procedure needs to be done on healthy individuals. I don't perform procedures on people that smoke. You have to be healthy, have a good diet, exercise plan, small areas of fat. The nice thing about this procedure is you walk into my office. It's done under local anesthesia.
Wow.
It does not cause any discomfort, and you walk out.
Yeah.
And usually it takes about 6 weeks to see results. Final results at 3 months.
Yeah. You had this done,
fantastic.
What, 6 months ago?
Yes.
Okay, and so what was it? Tell me about, like, when you went in there and had it done. Did you feel any pain at all, discomfort at all? Or?
You know, actually, I didn't feel any pain at all. And honestly, I had no bruising afterwards, and I went to work the next day.
Wow,
So.
okay. And then, so it's been 6 months now, and obviously, I'm looking at you. You look fantastic.
It just keeps getting better. So more defined, more tone, more definition.
And does it help to actually work out a little bit with it?
It does. As long as you maintain a healthy lifestyle, moderation in diet and exercise, I think you'll be very happy with the results.
Okay, we have a couple of audience members who have some questions. Hi there, ma'am.
Hi, I'm Pam. One of my questions was, does it hurt? And you kind of just said it doesn't. How can it not hurt?
Because you'll be skinny after. That's how it doesn't hurt.
That's worth it. Right. And how do you get back to work so fast?
The procedure itself is done under local anesthesia, and local anesthesia is a lidocaine mixture, just like when you go to the dentist and have a tooth pulled. It's a very similar technique, and the lidocaine is actually infused into the fat that helps the fat become a little plumper so that I can remove it.
Okay, thank you. We have another audience member who has a question. Hi there, ma'am.
Hi, my name is Gloria.
A lot of questions lined up here.
Oh, yeah. I bet you get this at cocktail parties. Like, he's a plastic surgeon? Which one? Right, there you go.
I was wondering, what is the average age of people getting this procedure?
There really is not an age limitation at all. As long as you maintain a healthy lifestyle and have a small area of fat that is persistent despite diet and exercise, you're a candidate.
Yeah, under the neck, saddlebags,
absolutely.
love
Arms,
handles.
under the neck, saddlebags, hips, thighs.
Oh, great.
That's a pretty neat procedure.
All right, next.
Hi, Dr. Livingston. I'm Jeanette, and I have a question on how long does it last, and what kind of food do I have to eat to maintain this, you know, with the procedure after the procedure?
That's kind of a loaded question, no pun intended.
Would you like a rib?
Yeah, exactly. I tell patients that you need to maintain a diet in moderation, low fat. Carbohydrates are sometimes a no-no, high protein. The procedure itself last as long as you continue to take my recommendations in terms of diet and exercise. Believe it or not, the amount of fat cells that our body produces is constant after adolescence. So if you actually remove those fat cells, you won't regain fat in the area that's been liposuctioned. You will gain it in other areas that have not been liposuctioned. So you have to be really careful about maintaining that diet and exercise
But in this
plan.
case, you're looking at patients who pretty much have a good sense of what they're
Correct.
eating in the whole, but anyway, it's just that problem spot where there's
Correct.
more deposits of fat. So for most people I know who've had this done, they're not making radical changes.
Right.
And
Right.
they're still able to hold those results. All right. Thank you very much. We have one more question. Time for one more question.
Hello.
I was wondering, like, how many inches normally and is it done in one session, and how much can you take off at one time from an area?
You can take out, certainly the goal of this procedure is to make my patients happy, and so you try to remove as much fat as possible so that gives you the slim toned look. In terms of how much can you take off, this is a procedure that's done under local anesthesia, so I feel comfortable doing the arms and the belly and the inner and outer thighs. Anything longer than that, a lot of times I would recommend general anesthesia.
All right. Thank you very
Thank you.
much.
You're welcome.
And thank you again. You look fantastic. Medical Spas of Houston is offering a fantastic special. If you call them by the end of January, you'll get a free consultation. All right? Plus, if you have the procedure, you'll receive a $1,000 discount. Okay? You can reach them at 281-598-7000, 281-598-7000, or on the web at medicalspasofmidtown.com, medicalspasofmidtown.com. If your New Year's resolution is to drop a few inches, well, there you go.
Don't forget, we also do some Botox and fillers and all the other good things.
All the other good stuff. Yeah,
Everything.
they're looking good all the way around.
You got
Right,
it.
so you can look younger and thinner all in a matter of minutes. All right, thank you very much. When we come back, designer Tori Halbert shares her plans for a special room makeover, and we'll tell you how you can win up to $10,000 in furniture, too.